Understanding vitamin D deficiency causes, clinical features, and treatment. Introduction. Vitamin D, often referred to as the sunshine vitamin, plays a crucial role in maintaining overall health and well-being. However, many people worldwide suffer from vitamin D deficiency, which can have significant implications on their health. In this article, we will explore the causes, clinical features, and treatment options for vitamin D deficiency. What is vitamin D? Vitamin D is a fat-soluble vitamin that plays a vital role in several bodily functions. It helps regulate the absorption of calcium and phosphorus, which are essential for bone health. Additionally, vitamin D is involved in immune system modulation, cell growth, and gene expression. There are two primary forms of vitamin D, vitamin D2 ergocalciferol and vitamin D3 cholecalciferol. Vitamin D2 is derived from plants and fortified foods, while vitamin D3 is synthesized in the skin when exposed to sunlight. Both forms can be utilized by the body, but vitamin D3 is considered more potent. Causes of vitamin D deficiency. 1. Inadequate sun exposure. Limited exposure to sunlight, particularly in regions with little sunlight or during winter months, can lead to vitamin D deficiency. 2. Lack of dietary intake. Some individuals may have a low intake of foods rich in vitamin D, such as fatty fish, fortified dairy products, and egg yolks, leading to deficiency. 3. Dark skin pigmentation. Melanin, a pigment responsible for skin color, can reduce the skin's ability to produce vitamin D when exposed to sunlight, resulting in a higher risk of deficiency among individuals with dark skin. 4. Age. The ability to synthesize vitamin D decreases with age, making older adults more prone to deficiency. 5. Obesity. Excess body fat can decrease the bioavailability of vitamin D, as it gets stored in fat cells and is less readily available for use by the body. Clinical features of vitamin D deficiency. Vitamin D deficiency can manifest in various ways, and its symptoms can be subtle or severe. Common clinical features include 1. Bone pain and muscle weakness. Vitamin D plays a vital role in maintaining bone health. Deficiency can lead to bone pain, muscle weakness, and an increased risk of fractures. 2. Fatigue and generalized weakness. Individuals with low vitamin D levels often experience fatigue, lack of energy, and generalized weakness. 3. Depressed mood. Some studies suggest a link between vitamin D deficiency and mood disorders such as depression. 4. Impaired wound healing. Vitamin D is involved in the healing process. Inadequate levels can slow down wound healing and impair recovery. Diagnosing vitamin D deficiency. A blood test called the 25-hydroxyvitamin D test is used to diagnose vitamin D deficiency. The results are reported as monograms per milliliter Ng/ml or nanomoles per liter ml/L. Generally, levels below 20 Ng/ml 50 ml/L are considered deficient, while levels between 20-30 Ng/ml 50-75 ml/L are classified as insufficient. P/2 treatment options for vitamin D deficiency. The primary treatment for vitamin D deficiency is supplementation. Vitamin D supplements are available in two forms: ergocalciferol vitamin D2 and cholecalciferol vitamin D3. The choice of supplement and dosage will depend on individual needs and healthcare provider recommendations. In cases of severe deficiency or underlying medical conditions, higher doses of vitamin D may be prescribed initially to correct the deficiency more rapidly. Regular monitoring of vitamin D levels through blood tests is crucial to ensure optimal supplementation. Prevention and management of vitamin D deficiency. 1. Sun exposure. Spending time outdoors and exposing the skin to sunlight can help the body produce vitamin D naturally. Aim for 10-30 minutes of sun exposure on the face, arms, or legs a few times a week. 2. Dietary sources. Include foods rich in vitamin D in your diet, such as fatty fish, salmon, mackerel, fortified dairy products, egg yolks, and fortified cereals. 3. Supplementation. If sun exposure and dietary sources are insufficient, consult a healthcare professional about vitamin D supplementation to meet your individual needs. 4. Regular check-ups. Routine blood tests to monitor vitamin D levels can help identify deficiencies earlier on and guide appropriate supplementation. Conclusion. Vitamin D deficiency is a common health concern with potential implications for bone health, immune function, and overall well-being. Understanding the causes, clinical features, and treatment options is crucial in preventing and managing this condition. By maintaining adequate sun exposure, incorporating vitamin D-rich foods into our diet, and considering supplementation when necessary, we can support our bodies in maintaining optimal vitamin D levels. Facts. 1. Can I get enough vitamin D from sunlight alone? While sunlight is an excellent source of vitamin D, factors such as geographic location, time of year, skin pigmentation, and sun protection practices can affect the amount of vitamin D synthesized. It's recommended to supplement sunlight exposure with dietary sources and, if needed, supplementation. 2. Are there any side effects of vitamin D supplementation? When taken as directed, vitamin D supplements are generally safe. However, excessive supplementation can lead to vitamin D toxicity, which can cause symptoms like nausea, vomiting, constipation, and weakness. It's essential to follow the recommended dosage and consult with a healthcare professional. 3. Can I obtain vitamin D from plant-based sources? While vitamin D2 is derived from plants, it may be challenging to obtain adequate levels solely from plant-based sources. Fortified foods like plant-based milk alternatives and cereals can help, but it's advisable to consider supplementation or regular monitoring of vitamin D levels. 4. Are there any population groups at higher risk of vitamin D deficiency? Yes, certain population groups are more susceptible to vitamin D deficiency, including older adults, individuals with limited sun exposure, people with darker skin pigmentation, and those with certain medical conditions that affect vitamin D absorption or metabolism. 5. Is it possible to overdose on vitamin D? Vitamin D toxicity is rare but can occur with excessive supplementation. It's crucial to follow recommended dosages and consult with a healthcare professional before initiating any new supplementation regimen.